Hello, my name is Douglas Finlay and this is my colleague Sian Rees from the Oxford Academic Health Science Network.
We would like to welcome you to this series of short video clips that have been put together following 3 webinars that we held in 2020. The title of the webinars was Inclusion for All, Working with Seldom Heard Groups. These webinars were supported by the Working Together Partnership, a coalition of organisations in the Thames Valley who collaborate to support co-production in research, education and service delivery.
The term seldom heard refers to groups of people who may be less likely to be heard by professionals and decision makers. They're sometimes referred to as hard to reach groups, though this term has been criticised for implying that there's something about these people that makes their engagement with services difficult. Seldom Heard places more of the emphasis on agencies to engage these service users, carers and potential service users.
There are many factors that can contribute to people who use services being less likely to be heard, including disability, ethnicity, sexuality, communication impairments, mental health problems, homelessness or geographical isolation. For these initial webinars, we focused on 3 groups: sensory impairment, learning disabilities, and the LGBTQ+ community. There's a recording for each of these.
We hoped that by inviting our speakers to describe their and other members of their community's experience, this would help all of us to appreciate the world from their point of view and help us to better involve them in our work. We specifically asked speakers to detail their hints and tips on how to do this.
We also hope that by listening to our speakers, it would help to reduce our natural tendency for unconscious bias by making us reflect on how we view people who are different from us.
Unconscious bias refers to our automatic patterns of thinking, which leads to decisions and judgments about other people that are often unfair and can therefore be seen as a form of prejudice. In order to get these people thinking about unconscious bias, we used a short video from the Royal Society, which can be found in the link below.
We very much hope that you will enjoy listening to our speakers and find it informative. If you want any further information, then please do get in touch with us in the first instance. We've included our contact details below. Hope you enjoy.
My name is Dawn and I'm a consultant at My Life, My Choice.
And my name is Jess and I also work at My Life, My Choice with Dawn. And My Life, My Choice is an Oxfordshire-based learning disability charity for adults. And today we're here to talk to you about helping people with learning disabilities use their voices and make sure that they're heard.
The voice and people with learning disabilities are often not listened to. Sometimes people with a learning disability find it hard to make their voice heard or find it hard to communicate what they want to say. Other times, people don't want to listen to people with a learning disability. They don't think they are important and don't care what they have to say about things.
There are many barriers that stop people with learning disabilities from sharing their views and opinions, their wants and their needs. One of the biggest barriers that people face is the presumption that what they have to say is just unimportant, that they aren't able to positively contribute to the conversation, so they just aren't asked. A lot of the time, people with learning disabilities know exactly how they feel and what they want to say, but the system makes it too hard for them to do so. In a MenCap survey, they found that 64% of people didn't vote in recent local elections. 60% of those people found it too hard to register, and 17% of those said that they had been turned away from polling stations. And this has happened to some of our friends as well. Could we have the next slide, please?
The NHS says that a person with a learning disability finds it harder to learn, understand, and to communicate.
According to the NHS, a learning disability usually has a significant impact on a person's life. A learning disability includes the presence of a significantly reduced ability to understand new or complex information, to learn new skills, with a reduced ability to cope independently, and it is something which started before adulthood, that has a lasting effect on someone's development. This should be noted as a very broad definition of what a learning disability is, and there is much more information about what does and does not meet the criteria for what a learning disability is, and this can also be found on the NHS website. Could we have the next slide, please?
But having a learning disability doesn't mean you just fit into a medical box. My disability is my own. It is different from my friends and it doesn't decline me. It might mean that I have trouble understanding things, but support and things done my way, I will get there in the end. I don't see myself as any different to anyone else. My Life, My Choice is a self-advocacy charity in Oxfordshire run by and for people with learning disabilities. It is there to help people speak up for themselves and what is important to them.
Self-advocacy is the ability to speak up for yourself and the things that are important to you. Self-advocacy means you are able to ask for what you need and want, and to tell people about your thoughts and feelings. Self-advocacy also means knowing your rights and your responsibilities and speaking up for your rights, and that you're able to make choices and decisions that affect your life and to support others to do that themselves as well. At My Life, My Choice, we all work together co-productively to improve the lives of people with learning disabilities and to teach others how it should be done. Could we have the next slide, please?
It is very important that we have a voice so we can get the same as everyone else. If we didn't have a voice, we wouldn't. Just because we have a learning disability, it doesn't mean we aren't as important or as other people. What we have to say is also important.
We all have the right to use our voices to speak up for ourselves and what we believe in. Article 10 of the 1998 Human Rights Act states that everybody has the right to freedom of expression. The 2006 Convention of Persons with Disabilities also states that people with disabilities have the right to their own thoughts, ideas, and opinions. It also says that people with disabilities have the right to be seen just as everyone else. People with disabilities have the right to be heard and the right to have their voices listened to.
Nothing about us without us.
Within the learning disability community, and in others I'm sure, we have a group of people known as experts by experience. They are people with lived experience of learning disabilities, whether that be themselves having a learning disability or maybe a family carer or someone with a learning disability. They are a group of people with lived experience of learning disabilities, whether that be themselves having a learning disability or maybe a family carer of someone with a learning disability.
Experts by experience know what it is like and can speak up for themselves, for other people. They use their experience and expertise of their friends and family to make changes for other people. At My Life, My Choice, we work on a care and treatment review to make sure people are getting the right care. We work with the Care Quality Commission and the local council to make sure providers are doing what they say they are doing, and to make sure people with learning disabilities are happy with what they are getting.
Our experts have worked with organisations around the country to make sure the voices of people with learning disabilities are heard and represented. They have also worked with organisations to try and teach them on how to be more inclusive of people with disabilities and how to make the most of their strengths.
A lot of times, people with a learning disability aren't listened to or not taken seriously. When I was younger, I tried to speak up about abuse that was happening to me. And my friends at my residential school, but no one took me seriously. Nobody believed me. It made me feel really angry and upset. No one took me seriously. Now I want to use my experience and make sure things are better for people in the future. By being on the expert by experience, I have support to be on meetings. I feel like people are listening to me and taking me seriously. I help people to get out of hospitals. I help to write the new charter of people with learning disability rights. I have helped create a new guideline for the care and support for people with learning disabilities. By working together, we can get it right for everyone. It is good to work with other people and to co-produce things because you can really get to know one another. You learn what is important to one another, and it can actually be done. What you want to do and how you want to do it. You can share ideas and have real conversations with each other. It can be hard to work together, and you need to work it out. You need to have everyone the same and listen to everyone. It is hard when you don't know someone and they don't know you. If someone doesn't know what a disability is, then they won't know what my strengths are and they might not take me seriously. If we communicate well and make reasonable adjustments, we can do really good work.
Working together takes time. You will need to allow for more time for meetings and for conversations. You may also need to make documents in an accessible format, such as easy read. You need to take time to get to know each other, how you would like to work together, and what each other's experiences are. And you need to be open with each other about what is achievable when you work together. Working with any support workers or family carers is really important, and you should always make sure that you include them in the conversation as well as the person with the disability. Most importantly, you shouldn't give up.
If you would like to get in touch with us at My Life, My Choice, you can email us, you can call us, or you can find us on Twitter. Thank you.
Morning, everybody. Nice to be here. So my name's Angeli and I work for Oxfordshire Family Support Network. We're a very small charity. In fact, I think I might need my next slide. Thank you. So we're, I work for a tiny charity which was set up in 2007, run by family carers of people with learning disabilities, so including me. So I have a son with learning disability and autism, and we work to support family carers with both children and adult family members. We aim to use our experiences as family carers to and experts by experience to support other families. And we're networked across Oxfordshire. So that means that we work across the whole county, and we have all sorts of parent carers who are trained up as family champions to support in the communities that they find themselves in, as well as having a sort of more conventional team-based, or at least we were based in an office in the centre, well, on the outskirts of Oxford. So next slide, please. So basically what we do in terms of supporting family carers, is to offer advice and information and training, as well as one-to-one support on issues that they need to deal with, sometimes immediately if it's a crisis, sometimes in the much longer term, so if they're planning for their own death and they need support to think about things that they need to understand. We also train and work with professionals in health and social care. A lot we focus on something called person-centred approaches or person-centred planning. We are involved in quite a lot of co-production work across the NHS and the local authority, and have a sort of whole work stream around partnership working, which we call Better Together. So that's the kind of work we do. We're also part of the Quality Checkers programme that Dawn referred to, and we work with My Life, My Choice to deliver that. So next slide, please. So I'd like to introduce you to some of our family carers. And this is Brenda. So Brenda's 93 and she is the oldest carer that we support. She has her own special title of an older carer. You get that accolade from the NHS and social care when you're around 65 plus. And one of the things we've worked really hard to achieve at OXFSN is the recognition and understanding that older carers who have had a lifetime of caring need particular support and understanding. So she, I think she carers, I noticed I've written, she cares for her daughter who lives next door to her, and she's age 67. So my book, I think that means Brenda's been caring for 67 years, plus the year that she was pregnant, so I reckon that makes 68. She lives in a village and Brenda has a telephone. That's how she communicates with people. Can I have my next slide, please? So the next person who I'd like to introduce you to is my colleague Kathy. So Kathy, like me, is in her 50s. She's got 4 children and she cares for her daughter who lives in her own home. And what that means if you're a person with a learning disability, it's a term often called supported living. And at OXFSN, we're very keen to lose the jargon. So I wouldn't necessarily talk about supported living. I'd say that her daughter lives in her own home with her friends. And what she actually has is 24 hours support. And the provision is brought in through a service provider called Styleacre, which will be very well known to many of you. So, and the funding is through a range of social care funding, and that's how that can happen. So she has a good life. She lives in a village. Kathy lives in a village. Her daughter actually lives nearby in a town, and Kathy is our administrator and charity trustee. Now, Kathy is an absolute whiz. She's got a PC, laptop, scanner, printer, Facebook, WhatsApp, Twitter account. She does all our comms. So unlike Brenda, who is nearly 40 years older, who has a phone, Kathy is wired. So the next slide, please. So this is my colleague Sam. So Sam has an 8-year-old son. She's in her 30s, and she's one of our team members, and she provides support to families via our face-to-face support service. And she in fact is a trained deaf interpreter. That's her degree. That's what she did at college. Only to discover that she herself had some hearing loss through an accident, in fact. So she lives in a town nearby, and her son has really complex medical needs. So she is in the John Radcliffe Hospital for, well, when an emergency strikes 24/7, and I live not very far, so I often offer to bring her snacks if she's had to leave very quickly. She hasn't had a chance to have anything to eat. So Sam runs her life through a mobile phone and a laptop. She doesn't have a PC. I think she probably has a printer. And she is also the coordinator of the Oxfordshire Parent Carer Forum, so a very busy lady. Okay, and can I have my next slide, please? So this is Ben. Ben gets the title of Young Carer, which is an accolade again awarded by social care in particular, but recognised within the NHS. So young carers are those who are under 18, and they usually, and certainly in Oxfordshire, have a special service to provide support to them. The current best known service is called Be Free Young Carers, but there's a bit of a patchy network actually of support for these young people. And as you might imagine, there are all sorts of reasons why life is much tougher for a young person with caring responsibilities. So this is a picture of Ben, aged 11. He lives at home in Oxford and has a brother with a learning disability. So at 15, leaping on a bit, Ben has Instagram, Facebook, Snapchat and mobile, access to PC, scanner, printer. And then by 18, Ben has grown up enough to have all the kit, all the technology that he could possibly need to create TikTok content and to be an internet influencer. So he is absolutely wired. So Ben is a carer and Brenda is a carer under the same umbrella. The difference between them is nearly 80 years, 70 to 80 years, and a lifetime of experience. Although by the time Ben is aged 11, he's already clocked up 7 years of caring experience. Okay, so if I could have my next slide, please. So who have I not talked about? So these are people that are known to me, that I work with, that I see regularly. So what you'll notice is that we're missing some men. So we've seen women, apart from Ben, this young lad who has no choice but to be a carer. So in my organisation and in my day-to-day life, so the men are missing, don't have very many siblings. Ben happens to be one, but not very many adult siblings. Don't have very young children. So, you know, the real tiddlers, sort of under 5s, and very few Black, Asian, minority ethnic communities, carers with learning disabilities themselves. And we don't have very much representation from carers from lower income households. There's been a bit of a chat around indices of deprivation going on in the background here, and Oxfordshire and Oxford City has some areas of particularly recognised, you know, pockets of really significant poverty, which meet thresholds nationally. And then, as you might say, the usual suspects, very little kind of contact with refugees, prisoners, traveller communities, and so you might go on. So we're very conscious of that in our organisation, in our daily lives. So we're a microcosm of the world that we see around us, in that people who are well represented in the general population, so white, middle class, and in this case women, for all the reasons that you might imagine in terms of caring responsibilities. We also find, in exactly the same way, family carers from all the other groups, other than men, which I think is interesting, are not well represented. And next slide, please. Before we think about working with academics or becoming involved in projects which ask us as family carers to get involved in participation in health and social care projects, whether it's from our GP surgery to some really quite significant National Institute of Health research funded projects, or the Quality Checkers project that Dawn has spoken about, which is a contract with the County Council. These are the decisions that we think about. So we wonder, are we going to be seen as difficult? Are we seen as difficult? Is that the unconscious bias or the conscious bias before we sign up to your project? And I would say that what you probably need to consider is understand that family carers are on a long journey to get help from their family members. So if they're seen as difficult, uncooperative, not turning up, or having their own agenda, all the things that can really ambush from your perspective work that you're doing to include family carers, understand that many of these people have been around for 20, 30, 40, 50, 60 years and had a pretty tough time in most cases. So when they come to your meeting, that's what they're carrying in the rucksack on their back. Are we just ticking your boxes? as local authorities, as people working in health and research, you have a lot of boxes to tick to get your project through, whatever your intentions, and they might be very honourable ones. You will have a lot of boxes to tick now. Some of that's very good, very helpful, some of that is not. And I think you're under pressure as professionals to make a difference. I think you feel responsible about making a difference to the people that you're asking to engage, and it can be really hard knowing that you're asking people to sign up for a 3-year project and not knowing in the end whether you will be able to follow through. You want to, but actually it's not your decision. So you need to be really honest with parents and carers about the difference your project will make. And even if that's hard for people to hear. And I think the other fear is that nothing will change. You know, so I give up this time, I get involved, but in the end, it's all going to be the same. Nothing's going to change as a result of this. I mean, you can't, again, we've talked about over-promising, that can't happen, but what you can do is to follow up with what happened as a result, or just to follow up and just to stay in touch. Those would be my tips. So next slide, please. So just 2 more slides to go, conscious that I'm talking a lot here. So these are my 8 top tips. These are based on working with family carers. We run a course every 2 years. It's an accredited course. It's sort of the equivalent to an A level in terms of the way it's been graded, but it's clearly not set up like that. And we asked family carers involved in it to put together a list of do's and don'ts for professionals, and it's something that we go into in much more detail and the training that we provide. But anyway, these are some of the 8 standouts. So what people say makes a difference is, well, and me too. So what to do with these 8 top tips. Sorry, I'm getting distracted by the chat coming at me. It's tricky to do both. So the first thing I would say to you is reach out to local and national support groups. Don't do it alone. So if you're setting up a project or you're considering going into an area, then use the expertise around you. I mean, I think Dawn and Jess have absolutely sold it. I think it's really clear that by going to some people like Dawn and Jess, they will signpost you and support you to get the help that you need, and likewise with OXFSN. So don't feel that you've got to face it alone, because it's complex, these relationships, and just sending an email is unlikely to land in the right place. I think, so I've touched on this again, so consider using a facilitator or peer-led organisations to help. So that's 2 slightly different things. A facilitator in a group situation can obviously create a little bit of distance between you and the organisation that you represent and are working for, and the people that you're trying to reach. And just having that kind of mediator, facilitator role can be helpful. That may or may not be somebody from a peer-led organisation, but it can often be extremely helpful. I would say, you know, think about your comms channels. Think about Brenda, think about Ben. How are you going to reach Brenda, Ben, Kathy and Sam? What I didn't do actually was have people in their sort of 70s who are a little bit in betweeny. Some people are great at their FaceTime and iPads, and some people absolutely not. But I think you need to throw everything at it: telephone, Zoom, face-to-face, letters, Facebook. I would also say build relationships, don't hit and run. And that kind of links back to this point about using peer-led organisations and local support groups where they've built the relationships. PPI work, so patient participation work or public participation and involvement work, has gained a bad reputation over the years for getting the information that people that they want, actually, and research as well. Getting the information they want from people and then saying thank you very much, goodbye. Now, some of that's about the sheer numbers involved if it's a large research study, but some of it's about really not understanding the impact. And you can have all the ethical committees in the world, but actually, and you can follow the ethics procedures, but still leave people feeling a little bit, you know, I don't feel like that was a great experience for me. So it's about building the relationships with the communities that you want to be involved with. And I saw at the beginning of the chat, somebody put a comment about, there's no excuse for poor community development, and that is absolutely right. Absolutely right. Then you do need to offer to pay for time. The NHS is a leader in this field, and the Involve guidelines are really excellent, and they're way ahead of local authorities in this respect. So do use them. Use the uniform. Now, I spent quite a lot of time working at the John Radcliffe Hospital some years ago, and it was really clear when we were working with Seldom Heard groups that actually what patients in that context wanted was to speak to the experts. It might be the doctors, the people who are actually doing the job. So what they don't want is administrators and project managers and all of that. What they want are the people who are in the theatres doing the work, the people in the front line. It's really difficult to get them there to your meetings because they're in the front line. They are GPs operating busy surgeries. They are people who are performing, I don't know, they're frontline nurses. So that's really difficult, but nobody wants to get out of bed to come and listen to an administrator. They really want the people there who are the influencers and the decision makers who can make a difference. This actually really goes back, the last number 7 is really about, it's really comms, I should have put them together, but it's, so I think we're a bit hung up on meetings, and COVID I think has probably done us a lot of good in terms of rethinking how we physically meet. But there are a lot of advantages for networking and family carers, but just meet where it suits the participants and be prepared to go there. I think there's a lot of really good work in health actually around that. I do see health at festivals and all sorts of places. And then finally, think about timings of your meetings. School run holidays are not good if you're working with older people, older carers. They may well be looking after somebody with a learning disability. Most people with learning disabilities live at home still. So it might take them a while to get going in the morning. So you really need to know, don't be surprised if you send out a generic invitation for a time that suits you best. And then they will, not turn up and you'll be surprised. Okay, so finally, last slide, just to say that these are the things to avoid when you're working with family carers. Jargon acronyms can be confusing. You know what you're talking about, so you have the power, so that imbalances. There, mum or dad, please don't call me mum, please don't call my husband dad, please learn our names. That again is about power imbalance. Give people time, the issues are going to be emotional. And I think we've touched on this very well, that please don't assume that family carers they're not a homogenous group. You need to think about that very carefully, as indeed many of you will be from health and social care sectors. You'll be doing person-centred planning, all sorts of things. I would also say, it says take things personally. Sorry, it should say don't take things personally. So absolutely don't take things personally. Upset family carers are quite, it's hard, and they've come a long way, and so it'll be frustration and anger with the system. So. We talked about over-delivering, over-promising, dismissing and ignoring concerns. So just as Dawn's talked about not being heard, not being listened to, her parents, if that had been my child, I would have become overprotective and extremely difficult in that situation. So understand that the concerns might not be your concerns, but they matter greatly. And then finally, getting your facts wrong. Family carers often know their onions. They've done the research. They're out there on the internet. They've spent years getting the information that they need. So when they're feeding back to you or in part of your involvement, then they may well know more than you about that particular subject. They might not know what you know, but what they know is still important. Okay, and that's me.
So yeah, my name's Rachel Miller. I'm Patient Experience and Involvement Lead for Learning Disabilities within Oxford Health. Next slide, please. So today I'm going to talk about the Leading Together group, which I coordinate. And the group met on a co-production course, which was run by the Oxford Academic Health Science Network. And we've chosen, it was a co-production course. We spent 3 days together learning how to work together, and some of us have chosen to continue working together. So today I'm going to talk a bit about that work. And we've been working together for probably the last year to try and make becoming a member of Oxford Health or becoming a governor of the trust both accessible and meaningful to people with a learning disability. And that's involved a wide range of activities, from creating easy read information about what it means to be a member of a trust or become a governor, to attending and feeding back on governors' meetings as they stand. And we've fed back on both in-person meeting, and last night we attended a virtual meeting for the first time. So I'll be collating the feedback from that later. And also helping our colleagues in human resources and finance to write their reports in an easy read format to make them accessible. Next slide, please. So how do we work together? So we used to meet face to face, and we used to really enjoy seeing each other. But obviously over the past few months with COVID, that hasn't been possible. So a few months ago, we decided to give meeting online a go. And I have to admit, I was quite anxious and I wasn't sure that could work for people with a learning disability. I have to admit, I was very fortunate in that all of the group are members of My Life, My Choice and actively involved in their activities. And My Life, My Choice had managed to source devices for all of the participants and set them up with email addresses, which made my task an awful lot easier. And I've also managed to find out a way previously to enable people to be paid for their work. We had to fill out paper forms and people had to sign those forms. But we've managed to find a way that I can fill out a form online and send it off, and that enables people to be paid. And that's really important. But I think it's also important to point out, I'm currently only really able to work online in terms of using Zoom or Teams or those kind of things with a very, very small group of people. And the reason being is most people with learning disabilities that I work with as experts by experience, they don't have access to smartphones or tablets or laptops. And even those that do, quite a lot of them don't have access to Wi-Fi and may well only have a pay-as-you-go phone. And a Zoom meeting is going to soon eat up your pay-as-you-go data allowance. So working online is only possible with a small group of experts by experience. And I'm still very much, I would say, in the learning phase of this. But with other people, I am still trying to work over the phone through sending documents out and letters, and then backing up with phone calls and discussions of that information. Next slide, please. I'm going to be honest, it hasn't always gone well. We've had quite a lot of trials and tribulations. The trust uses Microsoft Teams and wasn't keen on me using Zoom initially, but it soon became apparent, and the group of experts by experience had experience of the county council using Teams, and they found it really tricky, and it clearly wasn't going to work for all the group if we were going to use Microsoft Teams. So I had a couple of trials with a couple of people, and it worked with one, it didn't work with anybody else. So that was tricky. Timings of emails also proved to be key. I started out, as I would for meeting with other professionals, sending out an email and meeting invite when I set the meeting up. But then people found it difficult to find that email when the day of the meeting came. So I now send that out much just before the meeting starts. We also have had problems in sharing the screen, particularly over Zoom. We've been doing some work around the AGM and whether that works for people. An online one could work. So we tried to show them a video of it, and sadly, we couldn't share the audio. So that was trials and tribulations. So with Zoom, you may be aware you only get 40 minutes for free. So we now have 2 meetings with a tea break in between. And I also back that up. I post documents out to the group about what we're going to discuss in advance of the meeting. And you have to be organised and get those out and on their way. Next slide, please. So what seems to help, and I've alluded to some of those a little bit already. So making sure the emails go out at a timely time so that people can get the meeting in their diary, but then also so they've got an email they can easily click on to get the link. Don't try and cover too much in the agenda. What I found is that with online meetings, we can cover a lot less than we did in a face-to-face meeting, partly because we all need to be sure that we're on the same page, that we're understanding what's being discussed, and partly just because of the nature of online working and sometimes not being able to hear someone because someone's connection isn't great, etc., etc. So we now have decided that we used to meet every other month. We're now meeting monthly. And as I say, we meet for 40 minutes, have a tea break, and then another 40 minutes. We don't always use the whole of the second 40 minutes. And during the tea break, I email the link to the second meeting, and I don't email that link out before then. So next slide. So just to summarise, my top tips are you need to plan and prepare, especially if someone isn't familiar with using this kind of technology, be it Zoom or Teams. Doesn't mean they can't, it just might mean you need to take some time. So we've done things like created easy read instructions for getting into a meeting, particularly when we've tried to support people to join the governors or the AGM online, and ideally use screenshots. That can be really helpful. Make sure you've got everybody's phone number, because that can be really helpful. If people are struggling with the technology, a quick call can often iron those problems out. Having easy read information to enable people to think about what the meeting is going to discuss and to help them follow the meeting is great. Also some informal time. I was fortunate, the Leading Together group, we know each other quite well because we did the course together and we'd worked together probably for about a year face to face. So we know each other quite well. So we enjoy having a bit of a chat and an informal time, but we do know each other quite well. So I think if you were meeting with a new group of people, I would certainly build that in so that you know how to you can build that rapport and that that relationship really. Also so that people feel comfortable to say if they're not following or understanding, and also that you have a bit of a chance to get to know people so you can pick up if someone's struggling in the meeting. And also think carefully about how many people you have in the group. Certainly we have 5 experts by experience and some staff in leading together. And to be honest, I wouldn't want to try meeting online with any more. And probably if I was meeting with new people, I'd want to start smaller and gradually build the group up. Next slide, please. Okay, so in the normal world, I would have presented this jointly with one of the members of the group, but I wanted to try and bring in their voice to the presentation. So at our last meeting, I asked them what they thought about the fact that we were now working online. And there was a bit of a variety, really. Some felt it was good that we're learning new skills, and they were quite enjoying that. I think it was fairly universal that they quite liked not having to fill out forms to get paid, and that it taught them a new way to contact people that they could also use more socially and have contact with each other. And also it is easier in terms of travel. So the governors' meetings, for example, happen in the evening. And one of the barriers to people joining those meetings in the past has been that travel at night and the safety concerns around that. And so has relied on lift from members of staff largely, but partly because the location is a bit remote as well. But it does mean that for some individuals, it makes it easier to join because they don't need to travel there, and that it's nice to still be able to see each other. But on the flip side, some people still wanted to meet face to face. They missed that. And some people have busy houses, which makes meeting online difficult. And like all of us, I think at the moment, people are craving that contact with people. And people want to get out and about and see people. So next slide. So here I've just put a few resources that are free resources and useful if you're venturing in to try and create some easy read resources from scratch. If you think I might be able to help, or if you'd like me to share any other aspects of my experience, I spend a lot of time creating easy read at the moment, particularly around COVID. So if you think I might be able to help you, please do feel free to email me on my email address there.